Earlier this year, the Trump administration's defunding of USAID brought an abrupt halt to hundreds of global health programs, including those targeting tuberculosis. The disease kills more people than any other infectious agent, more than 1 million worldwide in 2023. In partnership with the Pulitzer Center, Fred Desam Lazaro reports from Bangladesh on efforts to contain the fallout.
The USAID signs are still all over this 250-bed hospital in Bangladesh's capital city. Inaugurated 4 years ago with state-of-the-art lab equipment, specialized doctors, and wards for the more dangerous MDR, multi-drug resistant cases, this was considered a model facility in the global effort to eradicate tuberculosis.
It's more challenge for us.
After the closure of USAID, Hospital Deputy Director Dr. Aisha Akhtar says they've had to pull in resources from other sectors of an already stressed public health system.
TB is a curable disease and we can prevent it easily. We can take drugs, antibiotics. USAID funded our TB drugs everywhere, but not only in this hospital, but all over Bangladesh.
Over the past decade, USAID spent more than $100 million to support Bangladesh's TB program, and it's paid off. TB deaths dropped 35% from 73,000 in 2015 to 44,000 in 2023.
Bangladesh has made significant strides in containing tuberculosis, but getting to the finish line is a daunting task amid conditions that are ideal for the infection to spread. Many people suffer from malnutrition, making them vulnerable to infections, and there is a sheer lack of space in one of the world's most densely populated countries.
The early detection is extremely important.
Asif Saleh heads the non-government organization BRAC, which leads a consortium of 13 groups still fighting TB with remaining support from the government and other international donors, trying to build on earlier successes, particularly in increased early detection, which is critical.
In 2001, we had about 27% detection rate, and that has gone up dramatically to 82%. Bangladesh's success in TB detection has been because of that. On one hand, there has been community mobilization and community awareness, and on the other hand, a lot of the new innovations that has come in, like mobile clinics, mobile detection facilities.
Mobile testing vans have been deployed in slums and many garment factories, the country's largest industry, densely crowded environments that are ripe for infection. Tuberculosis spreads through the air, attacks the lungs, and can be fatal if left untreated. Portable X-ray machines make the rounds of harder-to-reach rural areas. Radiographer Sultana Amin screens 50 to 100 people on any given day, X-raying lungs and using artificial intelligence to assign scores for each scan for the likelihood of TB.
How many patients come positive for TB in a month?
July month, 120.
120.
120 TB suspected.
So TB suspected means it's likely TB.
Right.
In this case, she determined a 90-year-old patient had a high likelihood of infection.
I have coughing. I have an uncomfortable feeling in my chest. And I have fever also. Now only Allah knows what will actually happen.
For patients whose X-rays find lesions that may be tuberculosis, this is the start of a journey that will take them next for more accurate testing and accordingly for treatment.
The goal is to catch infections early and start patients on a strict 6-month course of daily medication before the disease can spread further. And it's here that many fear progress will stall or worse. After the Trump administration issued a stop work order in January, detection, treatment, and research efforts like these were scaled back or shut down. Thousands of health workers lost their jobs. Many were employed by the USAID-funded International Center for Diarrheal and Disease Research. Center officials declined to participate in this report. Like many defunded USAID grantees, they cited fear of jeopardizing potential future funding.
Oftentimes, whether the foreign grants come or not is very whimsical. These are political decisions. So for that, you need to diversify. You need to have your own independence.
That's the big lesson from USAID's demise, says Asif Saleh of BRAC, which is considered one model, now the world's largest NGO operating in 12 developing countries. It relies on foreign aid, but also various businesses that generate revenue for its charitable work. Medical clinics for paying patients, a commercial bank, retail store for rural craft work, even a university.
Every country needs a thriving social sector. And I think Bangladeshi government as well need to think that how some of their own development budget can be used to for where implementation can be done by local NGOs.
My project was about to prepare the government to take the responsibility of managing and financing the tuberculosis program.
Dr. Nazmul Huda led a now shuttered USAID-funded project, ironically one intended to wean this country's TB program off foreign funding. Economic progress in recent years has moved Bangladesh from a less developed to a lower middle-income nation, something that will automatically mean a drop in foreign assistance.
It stopped at a very crucial time for the country. There is a process for technology transfer. So whatever we achieved in the last few years, we could not, transfer that result to the government.
He says the setback not only stalls Bangladesh's path towards self-reliance, but also threatens to reverse progress made, as fewer cases are detected and many that are diagnosed do not complete their treatment regimen.
It requires long treatment, and if there is interruption, more complexities might happen. For example, in the form of multi-drug resistant tuberculosis.
How many patients will have interrupted therapy?
The data, recent data, there is also interruption. Data is not coming,
So
because
you don't even know because the data has been interrupted as
yes.
well.
Some estimates are that tens of thousands of patients have seen their treatment stopped.
So the full impact of it is not visible as yet because it's early days.
Saleh says it's not just Bangladesh that should be concerned about infections that can emerge in the months and years ahead.
If it is not controlled within the borders, then it's just going to spread across all over the world. So we are going to go back to a situation where no country will be immune to these kinds of challenges.
Back in Washington, the Trump administration and congressional leaders have moved to restore some global health programs, including tuberculosis. But experts say many projects already dismantled will be difficult, if not impossible, to quickly restore. For the PBS NewsHour, this is Fred DeSam-Lazaro in the village of Raipur in Bangladesh.
And Fred's reporting is a partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.